I'm Tony Garr. I'm the former director of the Tennessee Healthcare Campaign. I retired from that work, and 2 months later I went to work with Enroll America. Enroll America is a nonprofit national group, has one mission, and that's to maximize enrollment under the Affordable Care Act. Doesn't have any other mission. That's the only mission. And the reason I emphasize that is because several other national groups have approached us and have said, why aren't you concerned about the Medicaid expansion? And I said, well, we are concerned about the Medicaid expansion, but that's not our mission. You know, and we think enrolling the first year 15 million Americans is more important, and we don't want to dilute our energy, our focus from that. And so we've been true to the mission. We are trying to basically maximize the enrollment of folks in America who are uninsured. So that's our only mission. And so I'm going to share with you a little bit of not only what we are, but later on in the workshop a little bit more details about how we hope to do our work. So I'm the Southeast State Assistance Manager for Enroll America. There's about 4 or 5 other folks like myself that are working in other parts of the country, but I'm working in the Southeast. And so as we go through this, you know, if you have questions, you can sort of stop me as we go through it, or we can also go to the end and we'll have question and answers too. But the reason I've asked this young lady to stand up and do jumping jacks after 15 minutes is so that we'll have plenty of questions. So, okay? You're all ready for the jumping jacks, right? All right, there you go. Okay. All right. This is the number that keeps me awake at night. And if I had to parse this out, and if I told, like, everybody on this side of the room, raise your hand. Everybody on this side, raise your hand. Okay? Okay. This many people know about the Affordable Care Act. You all don't know anything. I mean, when you start thinking about it, this is a pretty big stuff. 78% of Americans who are uninsured, they don't realize that it would help them. So who is surprised that they are opposed to the Affordable Care Act or opposed to Obamacare when they really don't understand what it is? And so that's the number that keeps me awake at night. Now, a year ago, we did the national survey. It was 78%. They've done other surveys since that time. It's come down some, but it really hasn't come down that much. There's still a significant number of Americans who really, really don't understand the Affordable Care Act and don't understand how they will help them. Now, let me just add this caveat. How many people in this room, well, you don't, how many people in this room have health insurance? Raise your hand. No, most everybody. The Affordable Care Act also helps you too. Does everybody realize that? I mean, the fact of the matter is that it helps you. Ultimately, it's going to bring down the cost of your health care. Your health care is going to get better. And I think what is even more important, I was talking to one gentleman here who actually is going to strike out and start his own business, and because he can do that after January 1. Fact is, after January 1, you know, he doesn't have to worry about taking a job just because it has good health insurance, or he doesn't have to worry about taking a job so that he can make sure his child who has a medical condition can also get health insurance. So many Americans, hundreds of thousands of Americans are locked into a job simply because it offers the health insurance and they want to provide for their family and provide insurance. So to a certain degree, this adds protection for all of us, even those with health insurance. Now, this is another number. You've heard previous speakers talk about why do you need to do outreach? What's the big deal? You know, I mean, you know, it's a program. It's affordable. I mean, they'll sign up, right? But when we look at history of other public programs, we realize that does not happen. I was talking to a doctor, Chuck Womack from Cookville earlier. Chuck is about my age. He's been practicing medicine for years. He had a wonderful story about Medicare. And let me just share that with you. Medicare started it was signed into law in 1965. The coverage did not begin until January 1, 1967. So it was about a year and a half before it actually kicked in. He said on January 1, 1967, the hospitals were flooded with people, older people, who had been putting off surgeries and medical needs that they had until they finally got their Medicare. And that's going to happen again. You know, there are thousands of people that do need medical care and they've been putting it off because they simply couldn't afford it. They were afraid to go to the doctor. They were afraid to go to the hospital because they did not want to accumulate thousands of dollars of medical debt for their family to deal with. And so I think we're going to see the same thing happen, but I'll talk with you a little bit more about that. But the fact of the matter, this one here, the CHIP program, Children's Health Insurance Program, it was signed into law in 1998. Here we are, 15 years later, and we're talking about there's still a significant number of kids who don't have health insurance. And so we got to correct that. So, you know, to a certain degree today, in today's world, every kid actually should have health insurance, either through Medicaid or their state's CHIP program or through private coverage. But still we're looking at kids. There's 50,000 kids in Tennessee. So we don't have to look at Illinois or Florida, but there's 50,000 kids in Tennessee who are uninsured. And so we all want to get our kids insurance. We want to get our neighbors' kids insured. So it really is important. And we start looking at that and you sort of ask yourself, well, why are these kids not insured? And so we got to think about that. Now, one other little caveat there is studies have shown that when parents are insured, it's much more likely for kids to be insured. And so, you know, you might say that logically doesn't make any sense. I mean, a parent really cares about their kid. Why don't they get them insured? But the fact of the matter is, data does tell us that if parents insured, it's more likely that the kids would be insured too. So in this whole process, as we go through this and get people enrolled onto the Affordable Care Act, you know, we also are going to be looking to make sure that those kids who are eligible are also insured. So it is going to take some outreach. It's not going to just happen. It is not going to just happen. So we've got to do outreach. Okay. Let me explain to you a few things that we found in our national research. Enroll America, about a year ago, did a national research trying to get a better understanding of who the uninsured are and what kind of things they face on a daily basis. And one of the things they did is they tried to capture the mental state of an uninsured person. And these are words that describe the mental state. They feel helpless, frustrated, stressed, overwhelmed, worried. Now, think about it. Think about it. When you are in this state of mind, are you going to go out and get yourself insured? No. You know, I think this, you know, they're living paycheck to paycheck. They're hoping when they get up out of bed the next morning and dress and go to work that their car will start. Because a month later they had to pay money that they didn't have on their charge card, you know, enough $200 to keep their car going. So these folks are basically living paycheck to paycheck, and they're trying to make things work for their family. And they're worried every day in regards to, how do I do this? And so when you start thinking about this, we got a huge challenge. Now this slide says 67% of the uninsured have been uninsured for at least 2 years. Well, let me give you another number that will scare you to whatever. Over half of these, or about 50% of the uninsured, have been uninsured for 5 or more years. So if you haven't done something for the last 5 years, why in the world would you think about doing it now? So you start thinking about this. You know, they haven't written out a premium check, you know, a monthly premium check for their premiums. Once again, premiums will be on a sliding scale. So whether their premium is $30 or whether it's $300, at least every month they're going to have to start paying something for their health insurance. So if they haven't done this for 5 years, why should they start? So you know, you might say, after we get them enrolled, we got another challenge of keeping them enrolled. Because, if they stop paying their monthly premium, what happens? They lose their coverage. Can they go back and get their coverage again? Not until the next open enrollment period. Okay? And then if they're uninsured for too long, then they actually end up paying a penalty if they stay uninsured for too long. So there's some really benefits for being insured, but there's some also consequences for all of a sudden. This is going to happen. Their car breaks down. They got to go to work. They got to put out $200 to get their car fixed, or $300 to get their car fixed, and then all of a sudden their insurance bill comes due, and they got to pay $30 and they don't have the $30. There's all kinds of things we've got to think about this, but our goal right now is just getting them enrolled. So we'll sort of worry about that next year, but right now we just really need to get them enrolled. But this is the mindset. Now, one of our challenges too is if they have that mindset, how do we move them over and to being confident that reassure them that this really will work. Now, so here you are, you're talking to somebody, it's mid-November, and they've heard on Fox News about how bad this is, how lousy it is, and you're trying to convince them that, hey, this is good benefits, this will provide the protection and security to your family that you've never had before because you haven't been insured for the last 5 years, and it's well worth it. And we got to convince them that there's some value in this. So how do we move them from that frustration, hell no, I don't understand this, it's not going to help my family, it's not of value to me. How do we move them from that mindset over to the mindset, hey, maybe this is not so bad. Gee whiz, I heard that Obamacare was the worst thing since whatever. So we've got a job to do. So it's not going to be easy. But I think we can get there, but it's going to take a lot of work. Now, in our national research, we did find out there were some messages that work better than other messages. One message, I'll tell you, that does not work really well is to basically say, if you don't sign up, you'll be fined. Okay. You don't start with that message, okay? But these other 4 messages will actually work for about 90% of everybody who's uninsured. At least they'll start thinking about it. Hey, these are good benefits, cover prescription drugs, it covers hospitalization, covers doctor visits. I'll have to pay a copay, but it covers all those things. Hey, these are good benefits. Another good message is, and it covers pre-existing conditions. You mean if I have diabetes, if I'm sick, I still get covered? Yeah, it will, because insurance companies have to change their business model. They can no longer just cover healthy people. They got to cover everybody. We're all human. We're all in this together. So it covers pre-existing condition. And then, well, what about the fine print that's always on the bottom? Well, they can't use the fine print anymore. So, and it's on a sliding scale. So there are a lot of good things, and these are the 4 messages that we have found in our research on a national level that will work for most people. Now, we've got to realize that, we can't persuade everyone. You got a question of this?
The no fine print, isn't that only for plans through the exchanges and marketplace?
Okay. He said the fine print, is that just for the plans in the exchange and in the marketplace?
No fine print.
No, actually, it applies to all the plans. All the plans. Yeah, all the plans across the board. Now, there will be a phase-in period. Let me give you an example. A small group policy, a small employer may sign an annual contract starting in November of this year that they have to be part of that other old plan for another year. And they really won't have the option until December of 2014 to maybe buy into the new plan. So there's a lot of that going on where businesses or insurers are trying to keep their market and trying to get people to sign contracts to stay part of their plan. So 2014 is going to be a real transition year. But in general, Okay, what does that mean? 5 seconds? Oh my gosh, okay, we gotta hurry, okay. How many want to see her do jumping jacks? No, okay. Oh, okay, all right. Good for you, okay. All right, who is gonna knock down the door on October 1? Of this group here. You have 5 here, who's gonna knock down the door? Who? Who's gonna knock down the door? Betty? Becky, who's gonna knock down the door? Of this group, who's gonna be knocking on the door? Let me in, let me enroll. The desperate and the believing. The folks with pre-existing condition. Now, they're going to be knocking down the door, but that's only about 13% of the uninsured. Okay, do you think our plan is going to survive if those are the only people that sign up? No, it's not. So the reality is that we have got to take the initiative and get out there and enroll. Now, real quickly, I'm going to go through a couple quick slides. We can actually get to some questions a little while. Tennessee is one of the top 14 uninsured states. Of those 14 states, they contain basically 2/3 of all the uninsured in the country. So if we do a good job there, we can actually move the country forward. You all may have seen this before. This is sort of, if you're trying to think about Tennesseans, this is sort of 3 categories of, this is the CHIP program, cover kids, pregnant women up to 185% of poverty, parents with children, only parents with children, and people with disabilities, 75% of poverty, around 65% of poverty. If you're a single adult, out of luck. And so the plan was to cover everybody up to 138% of poverty, but this group is being left out because Governor Haslam will not support Medicaid expansion. These are folks who will be eligible for the exchange and on a sliding scale of subsidies. Undocumented immigrants are not eligible for the coverage. This here is a simple example. If you were basically twice poverty, 200% of poverty, what is that income? When I say 200% of poverty, a family of 3, what does that look like? So if a family of 3 at twice poverty, they can make $39,000 a year and qualify for premium assistance and subsidies. Okay. This is just other chart. Okay. Now, Enroll America, real quickly, we are a group of profit and for-profit. What is the string that goes through all those groups? CVS is part of that, for-profit. What's the string that goes through all those groups? Holds all that groups together. They all what? They all benefit. Right. By maximizing enrollment, every one of those groups will benefit. So as an institution, those groups will benefit. And so they're all part of Enroll America. Enroll America will have staff in 10 states, but the other states, there will not be staff, but there will be me, in at least the southeastern states, and we're going to try to get the job done without staff. So that lists the states with staff. This is what we're looking for in Tennessee, and we'll get into some discussion. We've got to emulate what is being done in staff states, but we have to use all volunteers. And we have to get the job done. So we're going to be looking for people who are volunteers who will take leadership in these different areas.